I am Emily Slawski, and I am the Director of Occupational Therapy.
I'm Lauren Hansen. I am the VP of Service Delivery at Autism Care Partners.
I'm Rebecca Costa. I'm a clinical psychologist, and I am the Director of Psychology at Autism Care Partners.
I am Kara Morrison-Smith. I'm the AVP of VIS and Partnerships at ACP.
I'm Jill D'Angelo. I'm the Director of Speech Language Pathology.
I'm Elizabeth Bland. I am a BCBA and the Director of Training and Quality.
So any child wanting to come to us for a diagnostic evaluation will call our main 800 number and speak with one of our fabulous intake coordinators. And our intake coordinators will send out necessary paperwork and documents to get everything all ready to schedule the initial visit.
If we have a child that already has a diagnosis of autism, they would call our intake department as well and talk with them. They would get all the necessary paperwork set up needed, and then move directly to our centers where they'll talk with our family liaisons at each site, who are going to get them set up with a tour to come in and see our centers, meet our clinicians, see what we do. And then they will be scheduled for an assessment with one of our BCBAs.
Once the kiddos start at the centers for their ABA services, if we have an SLP and or an OT on site, we'll typically go in with, if we can get there within like the first 1 to 2 weeks of them starting at the center, the SLP or the OT will jump in. We'll do our own separate evaluation, typically just like an hour or so, and then we'll start treatment after that.
To have these experts all in one place working with one child all together is really a powerful thing, along with the then collaboration with the families. So we have had times where a family will come on for a meeting and it will be their behavior analyst, it'll be their SLP, it'll be their OT, all in one room having one conversation about one child, and getting so much information and collaborating together.
When we are looking to build a quality program for a client, we need to support both the clinicians and the BTs, behavior technicians, in training and their implementation of protocols.
The VIS is something that works across disciplines. So whether it's in applied behavioral analysis, occupational therapy, or speech language pathology, language has an impact. And if we're using the VIS, then we're addressing language. Now, if Emily is in an occupational therapy session and she is trying to describe to a client what he needs to do to put on a sock, and she's using a verb like pull, then we have a means by which in the VIS that we can make that work for that client. If Jill is in a speech language therapy session and she's trying to work on action object as a semantic relationship, then we have a way to teach that.
So as a speech language pathologist, I'm focused on teaching the kiddos language and teaching them functional communication, but there's so much that goes into getting the kiddos ready to learn from the other disciplines that I'm not trained in and I can't do. So without them, my kiddos are typically not ready to learn. So, sitting at the table, sensory regulation, being able to regulate things like that, being able to just come to the table and being ready to learn so that I can focus on what I need to focus on is really the biggest impact I've seen here.
Training and quality initiatives are really intended to focus on increasing the client's quality of life. So that revolves around both the BT's ability to work with the client and the behavior technician, the BCBA's ability to develop programs and work with caregivers and families to improve quality of life as well.
So I was working with a client in an occupational therapy session, and this particular client was moving about the room and would come back to the table and wanted to stand while they were doing their activity. And a behavior technician and a BCBA were present, and they said, let's see if we can get him to sit down. And I had educated that, from a sensory standpoint, this particular client does really well standing at the table and participating because they're getting a lot more sensory input through their legs. And what was really nice is that a couple days later, I had walked into a room and this same BT and BCBA were educating another BT about this client, specifically letting them know that, hey, it's okay if this client is standing at the table because they're getting their sensory input met and are still able to focus on the task that they're doing. And I think that really just goes to show that, simple education and sharing a different approach to a different client's need, right, was able to be transferred across OT to an ABA session as well.
The VIS encompasses all of our services, and we're working on expanding it across our clinics. But through the visual immersion system, we have a way of making sure each child comprehends language so that they can use it expressively on their own.
We had a child who was diagnosed by me at before age 2, so very young, and she was able to get ABA, speech, and OT, and we were able to see the progress that she made with all of those services combined, to where she graduated from our ABA program, successfully went on to kindergarten. I believe she met all of her language and occupational therapy goals. So it was really cool to see a success story like that, a child who had gone through all of our services and really flourished from them.
Coming from a practice where we were just speech pathologists and the kids came and saw me for 30 minutes and then they went home after that, I wore a lot of hats and I had to figure out kind of on my own, how do I manage this behavior? How do I, support that kiddo's sensory needs without the support? Now I can literally just yell out the door, "Hey, Emily, come on in. Come help me for a minute." And she's usually right there and is able to help. So
having the BTs able to sit in on OT and speech sessions allows us to educate them and then have that carried across their day, right? Our clients might be receiving 40 hours of ABA therapy, and right, they're able to help take the skills learned in OT or OT and speech and help generalize that across different environments and across their day.
Between ABA, OT, and speech, we really have shared goals for our clients and shared outcome. We want to have these increased quality of life. And we just have slightly different ways of saying them.
I think it's the kids, right? It's the natural reinforcement that they get from seeing the success of the clients that they're working with. And I would also say their coworkers, their teammates, the other people that work with them in maybe across disciplines as well, to see oh, I'm able to go and see the success that they had in speech that day. And then I'm also able to see how they did when we were doing toileting with them, and that was a success. And then we went and saw an OT and they were able to do this. That I think really motivates people to continue to do what they're doing.
I think people feel motivated as long as they never feel stuck. And at ACP, because of the support system and network that we have as therapists, it's not likely that anyone is going to feel stuck. And instead, we're able to facilitate the success of clients because we have layers and layers of supports, and that support is cross disciplines.
Morgan's a great kind of story to highlight, where she started as a behavior technician. Honestly, she may have started 5 or 6 years ago with ACP as a behavior technician, decided that she wanted to go to grad school for speech, started the speech program, got to do her clinical placement with our SLP here in Warwick, finished grad school, was hired on as an SLP clinical fellow, and is now a fully certified speech language pathologist, and she's staying with us. And it was a really cool, unique onboarding and training situation for Morgan as an SLP who had the BT background, to be able to come in and just see her transformation over the years. Is just really cool.
It's really special for me to get to, I went to one of the Pawtucket graduations recently, and it was one of the kids I had seen, and just seeing the change in them, and seeing how well our teams work together, how interdisciplinary we are. It doesn't end just when I'm done, with my assessment. I get to then feel confident in recommending our services and passing the kids off to capable hands that I know are really going to support them and their families, since the family component, I think, is so important too. Not just the child, but the whole family, the parents, the siblings. We just are able to support the entire family after that, which is really, really special for me, because sometimes in assessment, that relationship does end. We don't get to see how they do, and you wonder hey, I wonder how that person's doing. But I actually get to see how the kids are doing, see them make progress, and it's really, really cool.